Good afternoon. My name is Mary Eapen. I'm a family practice nurse practitioner at LIU. What is your name, sir?
My name is David Ramsahai.
Okay. Where name and date of birth?
My date of birth is on October 5th, 1995.
Great. Why you are here today?
I'm here for an annual checkup.
Good, good. This is the best place for the annual checkup. Okay. I have few questions to ask you before we get started. Can you please tell me who is the president of the country?
Donald Trump,
What day is it today?
April 22nd.
Okay, this is just to check, make sure that everything is the your alert orientation is correct. Okay, I'll be back. I'll be just wash my hands and I'll be back. Okay, first I will be taking the vital signs. I'll take the blood pressure. Do you know what is your normal blood pressure?
120/80.
First, I'm just going to feel the oscillatory gap. Okay. Blood pressure is good on the right side. It's 120/80. I'm just going to do it on the left side. It's good. On the left arm is like 122/80. There's not much variation, so there's no occlusions across the aorta. Okay, now I'm going to take your pulse. I'm going to take for 1 minute pulse. Can you please tell me? Okay. Okay, 62 is the pulse. Okay, now before I continue doing the Pettitoa assessment, I just wanted to take a look at your skin and then your head, and then from there, I see the arms. It's like great. The skin is smooth, no roughness, no scales, no macules, or no masses noted. The hands is the nails is smooth, no clubbing. Capillary reflex is less than 3 seconds. Just wanted to look at the palm. Palm is like normal color. It looks very good, hydrated. Just wanted to take a look at the back to see if there is any pain, any swelling, anything like that. You feel it?
No.
Skin looks smooth and then normal. No masses, no abnormality noted. Okay, now I'm going to start, I'm going to look at your head. Um, I'm going to feel any pain, any numbness, let me know. Any pain?
No.
Okay. Hair is evenly distributed, no patches, no scales. Hair is smooth and black color. Okay. Look up. I see your face is symmetric. Your nostrils are symmetric. No uneven um, facial expression noticed. Okay. Now, before I could move on, I'm going to start do the lymph nodes, the sinuses. So I'm just going to feel your cham- um, temporal nodes. Any pain?
No.
Okay. This is the mastoids. Any pain?
No.
Okay. Okay. Next, I'm going to check for your sinus nodes. Okay. This is the pre-auricle. Any pain?
No.
Post-auricle. Any pain?
No.
Okay. Occipital.
No.
Okay. This is the tonsillar,
No.
submandibular nodes, submandible, superior clavicular, posterior clavicular, anterior clavicular. No nodes were found. Now I'm just going to go ahead and do the cranial nerves. So I have, I want you to feel this and tell me what is this?
Alcohol.
Okay, this.
Alcohol.
Okay, that's the cranial nerve 1. Okay, the next one is a cranial nerve 2, which I'm going to look for the which I'm going to look for the peripheral visions. So you're going to tell me when you see my fingers coming up.
I see them. No. No.
Okay. The cranial nerve 2 is intact. Next one I'm going to check is the cranial nerve 3, 4, and 6. So for that, I want you to look at my pen, and then you're going to follow my pen. Okay? Good. Cranial nerve 3, 4, and 6 are intact. Now I wanted to look at the pupillary reflex. Just going to turn off the light. Okay. Can you remove the eyeglass, please? Okay. Just wanted to look at the eyes. Okay, the pupils equal, react to light. Okay. Close one eyes for me. Okay, the convergence, the other eye now. Okay, it's good. Okay, let me just turn the light on. Okay, now I'm going to look at your facial nerve. So I'm going to ask you to raise your eyebrows. Okay, puff up your cheeks, smile. Okay, frown. Okay, show me your teeth. Okay, good. Teeth are good, and then it's hugging. Okay, now I'm going to check for your cranial nerve 5. Let me know when you feel this when I touch you.
No.
Okay.
No.
Okay, the cranial nerve 5 and the cranial nerve 7 is intact. Now I'm going to ask you to open your mouth and then say ah for me. That's for the cranial nerve 9 and cranial nerve 10. Open your mouth and say ah. Okay, I see the palate is midline, and then palate is rising upward. Now I'm going to be doing the cranial nerve uh, 11, which is the I'm going to press it down. You're going to raise it up. Okay, racist. Good, good. Okay, now the last one is the cranial nerve chawl. I want you to stick out your tongue. Okay, turn towards the left, to the right. Okay, good. The cranial nerve chawl is also intact. So before I get into the next why I'm going to be looking at your ears and okay for the inspection. Any pain?
No.
Okay. I just wanted to go check the ear. Okay, I see slight cherubim, which is normal. I see the cone of light, and the eardrum is not. And no, I don't see any perforation. Let me just check in the other ear. Okay, I see a slight cherubim in the cone of light. I see it. Eardrum is patent. No exudate or no discharges. Okay, now I'm going to do the test, Weber test. It's called Weber test. I want you to tell me when you hear the sound. Do you hear it in both ears?
Yes.
Let me know when it's finished.
It's done.
Okay. Now I'm going to do the Renate test. I'm going to keep the vibration on your mastoid board. When it's finished there, I'm going to bring it to the ear. You're going to tell me when you hit stop there. Here.
Yes.
Let me know when it stops.
Stopped.
Let me know when you stop.
Stopped.
Okay. Do the same thing in the left. Let me know when it stops.
Stopped. Stopped.
Okay. I'm going to do the whisper test, which is I want you to close the ear, one ear. Okay, and I'm going to whisper.
66.
Okay, good. You can close this eye.
99.
Okay, great. Your ears are intact. So the next one, I'm going to move it to the mouth. So I want you to open your mouth. Stick out your tongue. Okay. The mouth is tongue is midline. No rashes. No lesions noted. Um, Normal movements. And I just want to take a look at the nostrils. Okay. Nostrils midline, no lesions, no rashes, no exudate noted. Okay, now I'm going to move on to the. Now I'm going to ask you to turn. I want you to turn towards the other side. I'm going to assess your back, posterior spine, and then the kidney, and then your lungs. Okay. Okay, the spine looks. Any pain?
No.
Okay, the spine looks symmetric. No, no deformities noted. No rashes, no lesions, or any masses noted. I'm going to feel it and let me know if you have any pain anywhere.
No pain.
Okay. I just wanted to check the symmetry of the breathing, so I want you to breathe in and out for me. Okay, normal symmetry, no deformities, no deformities noted. Okay, I just wanted, I'm going to check for your kidney, so I'm going to tap it and then you let me know if you have any pain, okay?
No. No.
Okay, great. Okay, now I'm just going to feel the back and the spine area. Um, no pain.
Okay.
Okay, great. Okay, now when I tell you, when you're going to feel my hand, you're going to say 99. Okay?
99, 99, 99, 99, 99, 99, 99, 99.
Okay. Now I'm going to do with my hand. I want you to say E.
E, 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 E.
Okay, great. Now I'm going to listen to your, when I'm going to palpate, I'm going to auscultate your lungs. When I put my stethoscope, I'll tell you take a deep breath in and out, okay? Let me know if you cannot do it. I will slow down. Deep breathe in and out. Good. Okay, the breath sounds are normal. No, no abnormal sounds noted. Okay, now I want you to turn towards me. And before I go into the next step, I just wanted to check your neck, which I missed it. I wanted to check the strength of the cranial nerve 7. So I wanted to push against my hand. Okay, this pushes against my hand. Okay, good, great. It's intact. Now I'm just going to ask you to lie down. Okay, I'm just going to move the point so you will be comfortable. Okay, I just wanted to loosen up the gown. Okay, okay, I'm just inspecting as don't see any rashes, any abnormalities on the chest. Skin looks good, very good skin turgor. I'm going to check for the pulses, the heart valves. It's the aortic, it's the pulmonic, it's the tricuspid, it's the mitral. Okay. Now I'm going to listen to it my bell to see if there is any murmur. It's the aortic, pulmonic, tricuspid, mitral. Okay. No abnormal sounds. S1, S2 is vacant. I just wanted to feel it. Any pain?
No.
Okay. Okay. Now, while you are on your back, I just want to listen to the lungs in the front. So I will tell you, take a deep breath in and out. Breathe in and out. Okay. Air is moving evenly in apex and the base of the lungs. Okay, now I want you to turn to your left side. I'm just going to feel for the, you could put your head relaxed, and then I'm just going to feel the PMI, which is at the fifth intercostal and the mid clavicular. Great. Okay, you could lay on your back. Relax. I know it's like a long process, long time. Now I'll be checking your, while you're lying down, I'm going to check for your pulse, which is, I'm going to check for your pedal pulse, which is, your pedal pulse is, right pedal pulse is 2 plus. Your dorsalis pulse is 2 plus. Your left pedal pulse is 2 plus. Your left dorsalis pulse is 2 plus. Okay. While you are lying down, I want to check the lower extremity range of motion. So what I want you to do is, first I want to check the range of motion of the hip. So what I want you to do is like, I want you to bend the right knee towards your chest. Okay, good. Backward. Okay. On the left side. Good. Backward. Now I want you to bring the right leg outward. Bring it out. Good. You could bring inward. Now the left leg outward and then bring it inward. Good job. Now I want you to the right leg, you're going to cross over to the left leg. Good. Same with the left leg. Good. Now I see the hip is intact. So now I just wanted to, I'm going to ask you to sit down. So I'm just going to move this down inside. Okay, I want you to sit comfortably. Make yourself comfortable. Okay, now I'm going to assess the lower extremity strength. So what I'm going to do is I'm going to push your knees down. So you're going to resist when I'm going to push it down. Okay, you could resist. Good. I'm trying to separate. You're going to resist me. Okay. Now you're going to resist me. Okay. Now on the now I'm going to the lower extremity strength, and I'm going to pull it. So when I'm going to pull it, you're going to resist. Okay. When I'm going to push, you're going to resist. Okay, great. Same thing with this. When I'm going to push, you're going to resist. When I'm going to pull, you're going to resist. Okay. Now I want you to you're going to resist with the, I'm going to check your ankle strength. Resist. Down. Okay. Now I'm going to check your ankles on the right. You're going to resist and then down. Okay. I want you to keep your both legs together. I want you to bring your inward the ankle. Bring it inward. Okay. Outward. Okay. I want you to flare the toes. Okay. Downward. Okay. Great. Okay. I want you to check the strength of the lower extremities. So I'm going to push it. You're going to resist me. Okay. Good job. Good job. Okay, now I want you to take your left leg and then from heel to chin, just rub it from the heel to chin. Okay, great. Do it with the other from the top to bottom. Great. Okay. Now I want you to check the reflexes. So I want you to check the biceps and the triceps. So I'm going to ask you to keep your arms. Okay. I'm going to check your triceps. Okay. That's good. Okay, and I'm going to do the same thing in this arm. Okay. I'm going to do the triceps. Okay. Good. Now I'm going to see the right knee. Okay. Now I'm going to do the patellar reflex. Okay. Now I'm going to do the left knee. Okay, you see the reflex? Good. While I'm here, I'm going to do the Babinski reflex, which is I'm going to scratch it is sharp, so you're going to do the flaring. Okay. Okay, great. Reflex is great. Okay, now I want you to I want you to go back, which I missed one of the part which I did not assess. I have to palpate the liver and the organs, which I missed it. I'm coming back to it. So while you're lying down, I'm going to inspect the stomach. The stomach, the four quadrants, there is no abnormality. There's some stretch marks in the stomach. So I'm just going to palpate, a soft palpate and a hard palpation. So while I'm palpating, let me know if you have any pain or tenderness, okay? Any pain?
No.
Okay. Okay. Now I'm going to feel for your liver. It's going to be deep palpation. It's going to be painful. It's a little painful. Just let me know if I hurt you. Okay, deep breathe in and out. Okay, the liver is dull. And I'm just going to feel for the spleen. Okay, I want you to take a deep breath in and out. Okay, great, 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 great. The spleen, I did not feel it, which is normal. I'm just going to assess your stomach. I'm just going to, no pain in the all four quadrants. So I'm just going to listen for the abdominal sounds in four quadrants. Okay, vowel sounds are normal on all four quadrants. Okay. Now can you please set up for me? Okay. Now just going to type. I want you to. It's almost done. Okay. 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 One of the tests that we didn't do for the eyes, I'm going to ask you to do it now while you're standing up. Okay. You could stand up. Okay. Can you please stay here and then read line number 5? You can put your eyeglass on.
PECFD.
Great. Can you take the eyeglass and cannot read it? Can you close one eye and then read it? Yes.
Okay, so PECFD.
Okay, you can use the other eye.
PECFD.
Great. Okay, so while we are standing, you're going to imagine as an imaginary line. I want you to walk straight like normal walk. Great, great, great. Okay, I want you to turn out. When you turn and walk, you're going to walk with your heel and the toe. Great, great, great. When you're walking backward, I want you to walk on the heels. Great, great. Now I want you to walk on your toes. Great, great, great. Okay, you can come back. Okay, now I want you to just check your balance. So I want you to put your arms up and then supinate, turn the other way. Okay, great. Open like this. Okay. Now I want you to close your eyes. I'm going to push it down. You're going to resist my hand. Okay? Okay. Good, good, good job. Okay, you can put your hands down. Okay, now I want you to bend forward to touch your toes. Good, good job. Now you can go back, then you can lean backward how much ever you can go. Good. Now you can put your hands on the hips and then turn towards left and turn towards the right. Can you move your hips and then turn? Good. Good job. Good job. Good job. I think we come to the last one. I just wanted to check your strength on the upper extremities. Can you excuse my hand? Okay. And then can you bring the arms like to over the hand? Oh, okay. No, one at a time. One, this one back, and then the right side. Okay. Now can you bring this towards your back? Good, good. Okay. Now can you bring the other one to the? Good job, good job. I just wanted to check the strength on the upper extremity. So what I'm going to do is I'm going to pull while I'm pulling, you are resisting. Okay, great, great job. I think we covered all of that, and I think you are in wonderful shape. Thank you so much, and take care.
Thank
Thank
you.
you.